Hello, I am Dr. Kioti Emmily, the co-founder and executive director of South Sudanese Women in Medicine, abbreviated as SWIM with a double S. This is an organization that mobilizes female South Sudanese medical doctors, pharmacists, dentists for the advancement of their roles, engagements, and potentials towards responding to South Sudan's health needs and challenges. My leadership project is aimed at empowering the career choices of South Sudanese women in medicine. To get the ball rolling, let me introduce to you Dr. Atong and the status quo she dwells in inside South Sudan. That is Dr. Atong. Currently, Dr. Atong exists in a status quo characterized by disproportionately low representation of women in the healthcare workforce at all levels in a country that boasts an enacted policy of 35% affirmative action for women's representation at all levels of government. A status quo with low pay for healthcare workers, pressure to conform to society's measure of social success, prized above career success. All this is amidst career progression opportunities that she ought to harness to measure up in her profession. As a result, a recent survey we undertook shows that women like Dr. Atong have mixed satisfaction about their career success levels. They also direly need career boost and support for resilience in such a status quo. Now, this is why I have proposed the establishment of a career boost hub to empower their choices, their career choices and prospects. In the beginning, the hub will have simple facilities, including boardroom design setup, internet, a support staff, or we'll call them an administrator, as well as water for keeping beneficiaries hydrated while using it. Now, so far, SWIM has commenced with preparation of a pre-introduction survey that has been conducted for the hub to know what else is needed and the proposed solutions by prospective beneficiaries, and which then can be used to improve the hub to be more useful to them. It is through the survey that we now know that they will need professional development courses, access to a virtual library, and journals, among others. Through our past engagements with them and the survey, it has been possible to establish a pathway to establishing a sustainable career boost hub. The pathway emphasizes the need for continued evaluation of experiences of medical women who will use it and eventually inform improvement of its services. With this project and a clear pathway for establishing it, it will be possible to realize a new status quo where a woman like Dr. Atong is facilitated to access career growth opportunities that increase her confidence levels, soft skills, career progression rate, which will in turn increase her presence in healthcare leadership and ultimately lead to gender equal human resources for health in South Sudan. This is the vision of the project. Now, again, this vision is determined by the leader I have clarified of myself through the WomenLift Health Leadership Program, one who would care to remove barriers after listening to those who are intended to benefit from a program by seeking to listen to them in order to understand and knowing that feedback is healthy, should be sought and taught, and that change is always an opportunity for growth. These are things that I gained from my executive coaching as well as the mentoring touch points. When all is said and done, I hope that the Career Boost Hub will turn Dr. Atong from a professional with mixed to one of satisfaction in her career progression with limitless career prospects. Thank you for your time and attention.